All right, time for the Health Watch. As always, we're joined by Dr. Syed Hussain from Trinity Health in New England. Good to see you again, sir.
Likewise, Tim.
All right, we're starting by talking about some viruses here. Dengue virus. There's now a CDC travel advisory because of it. What do people need to know?
Yeah, so dengue is a fairly common disease. It's a viral disease transmitted through mosquitoes, Tim, and actually 4 billion people, that's half of the global population, live in a country or an area where dengue is common. So why the alert now from the CDC is because spring and summer is usually when we see an uptick. We see more travelers. So just to put things into perspective, last year, for instance, we had about 3,400 cases, mostly travel-related cases, actually all of them travel-related cases, detected in the continental United States. There were less than 100 that were local.
Right.
But a large chunk, like I said, over 3,000 related to travel. So it's important people who are traveling take a look at the CDC alert, talk to your provider, because there are some precautions you can take. The biggest precaution for viewers is protect yourself from mosquitoes. Let's talk a little bit about symptoms, though.
Okay.
There's usually an incubation period, so up to a week, where there will be no symptoms, but after that, there's a whole range. It can be mild to severe, and it can start with fever, nausea, vomiting, abdominal pain, fatigue, headache, pain behind the eyes. There are some warning signs that people should take note of, especially persistent vomiting, abdominal pain, or fluid collection in your abdomen, or lungs, which can lead to shortness of breath. All of those are warning signs, red flags. But if you have been to an area which sees a lot of dengue, and you develop any kind of symptoms, please seek medical care.
Yes, but most importantly, this is mosquito-borne, not person-to-person.
Exactly. No, it's not person-to-person.
Like measles. You had mentioned incubation periods. Measles has a very long
3
one.
weeks, that's
3
right.
weeks where you can be
3
contagious.
weeks.
Yes, up to. Now, putting that into context, we've seen 4 cases now in New York State. This long incubation period, of course, would lead people to believe, oh, is this a tip of something bigger? How worried should we be about that here in Connecticut?
Yeah, general public risk remains low. The folks that need to take heed, take attention, do something are those individuals that are not vaccinated. If your child is lagging behind in the immunization schedule, now is the time to get that first shot. Especially, remember, there's a two shots measles vaccine, a part of MMR. And it's really, really important folks get that, because we're seeing more and more disease outbreaks. The one that started in late January in Texas, Northwest Texas, still continues. There are over 300 now impacted individuals.
Yeah.
We've seen a few cases now in Oklahoma, and like you mentioned, the 4 unrelated cases to the outbreak in Texas in New York.
How important of a distinction is that is unrelated to the outbreak in Texas?
It's important because it shows that there are pockets now of where immunization or vaccination rates are lagging, and it can be transmitted through travel or other different, avenues. It's a highly contagious disease.
Yes.
So, in areas where vaccination rates are low, people are at risk.
All right. And then lastly, we want to talk about one study. Always have to have the caveat. This is sort of one very small study in terms of how to maybe prevent Alzheimer's disease. But it had promising results, right?
This is a very interesting small study and multi-year study too, led through by the NIH, Tim. And in a nutshell, what it is individuals that are high risk of developing Alzheimer's. There's almost 100% guarantee they will.
Genetically.
Because they carry that gene mutation. And there have been many members in their families who've developed Alzheimer's and early Alzheimer's. So they've been on medication to prevent formation of this sticky gunk called amyloid that is at the root of Alzheimer's. And it's been pretty promising, because they've been able to, the onset of symptoms have been delayed in these individuals.
Yeah.
So all points to the importance of public funding, research, NIH funding as well with these studies.
Yeah, and this is working in concert with some other studies and drugs that are working to reduce amyloid or prevent them entirely. So it looks like that is becoming a more promising path.
That's right. There are 2 drugs right now that are currently approved with modest efficacy.
Okay, there you go. Thank you so much. Good to see you again, Doctor.
Likewise.
Now, if you have a question you would like Dr. Hussain to answer during our Health Watch segments, you can send it to us. Text the keywords Health Watch to the number on your screen, 860-527-6161. And then, of course, follow that up with your question and give us your name and where you're from so we could give you credit. Again, text Health Watch and your question to 860-527-6161.